Now, this is a very interesting Hrct of the chest that we are seeing, and there are so many findings. If we can simply pause and try to find out the problems, then what we can see in when we zoom in is definitely this is Hrct of the chest because we can see the lung tissue. This is the lung tissue that we can very easily notice, where we can easily comment that this is definitely a lung tissue. This is heart. This is the thoracic vertebra. So this is all the heart tissue that we can very easily notice. This is the heart tissue. This is the lung. This is the lung tissue, which we can very clearly notice. And this is the trachea. This is trachea because it is in the center, and we can actually trace this trachea here, here, here. Now there is a division in two main bronchi. This is going to the right lung, this is going to left lung, this is left. This side is left and this side is right. So what is apparent is in this left lung, when we discuss each and every lung, what we can discuss is the extreme, sorry. This is the right lung, which we can very easily and clearly notice. This has almost normal lung parenchymal um involvement or normal lung parenchymal appearance, as it has these are bronchovascular markings which are there, and the lung is pretty homogeneous on this right side. But in here, this type of lung is not at all seen. See, this is all heart. This is all portion of heart or mediastinum, which we can simply trace. Here also, this is heart shadows, which can very clearly trace. And on this left lung, where the lung should have been there, but there are some cystic lesions. There are some cystic lesions with a very thick fibrotic lining. So this dense white, these are definitely cysts. These are definitely cysts which are thick walled, and this dense white fibers or this dense white lesions, it is all fibrocystic disease. Means these are definitely cysts for sure. So we'll be labeling this as cystic disease. And second thing, this dense white lines, these all suggest the fibrosis, because in fibrotic disease or in fibrosis, the whatever normal tissue is there is replaced by dense, inelastic, fibrotic tissue, which appears hyperdense, which appears very dense white on CT scan of the chest. So if you see, this is typical normal lung, which we can see here. So there are no dense white streaks. It means that the fibrosis is not in this lung field. Whatever small dots appear, they are actually the normal bronchovascular markings. But just see on this left side that these are all formed cysts. These are all cysts with the dense white streaks which suggest fibrosis. So this is a very typical example of a fibrocystic disease where lung parenchyma is significantly replaced with cystic lesions with fibrosis. So this lung does not take part in oxygenation. So this lung will not help the patient to draw the oxygen from air to the blood. So this patient will definitely have hypoxemia, though the normal lung may compensate. But this hypoxemia is very easily evident if the patients walk. At rest, if the patient is sleeping, the saturation of oxygen may be, it can be around 95 or 96. It may be up to 100% also, because the right-sided lung is still functioning. It is functioning more, but this patient will definitely have significant shortness of breath, These patients will have the palpitations and easy fatigability because this left lung will not at all support the exercises, ambulation. So these patients have a repeated tendency of getting admitted to the hospital. These patients have repeated chances of lower respiratory tract infections. So these patients must receive swine flu vaccination, H1N1 vaccination, H3N2 vaccination, and pneumococcal vaccinations are also to prevent these infections and to prevent hospitalization because of these infections. Now, what we can see is along with this cystic lesions, we have in between the bronchiectatic lesions also. So, what is bronchiectasis? Is an abnormal dilatation of this bronchiole. So, which will be of significantly smaller size compared to the cystic lesions because bronchi they will be of smaller, they will be dense white, and they will have a thick wall. Whereas in cystic, they usually have compared to thinner wall compared to bronchiectatic lesion, and they will have significant larger area. So this is very typical cystic lesion, whereas this is a bronchiectatic lesion. So bronchiectatic lesions will be smaller in size, whereas cystic lesions they will vary in size. So this size, this size, this size, and these sizes they are totally different. So this is cystic lesion along with cystic bronchiectatic lesions also. This is the normal lung. There are some other interesting things also which we can see is the if we can see the lung is completely the heart on mediastinal shadow is completely shifted to the left side. So there is shifting or a drawing of this mediastinum towards complete left side. This is the vertebral body. So this is the midline. This is the midline. So on the right side, there is no heart at all. There is no mediastinum at all. It is all pushed to the left side by this large structure. So this cystic bronchiectasis fibrosis also pulls the lung toward the left side, pulls the mediastinum heart toward the left side, and this large structure on this right side is also pushing the mediastinum to the left side. So you can see here, this is the trachea which is completely shifted to the right side. So it should have been like here, and this mediastinum should have been like here. But in this uh, image, this heart is completely shifted to the left side because it is pushed by this right-sided structure and pulled by this fibrocystic disease. Now, if you can see here, this is either pneumothorax or this is either a large emphysematous bulla. So, how to come to know if it is pneumothorax? Will not be able to see any lung margins. Now, just see here, we can very easily notice that here the lung tissue is there, here also the lung tissue is there, and this has a margin, a very well non-tense margin. Here also we can see that there is lung margin is visible completely. So if it would have been pneumothorax, this air must have spread completely like this, and it should have pushed the lung and it would have caused collapse. But in this thing, we can very easily notice that the lung margin is there. So this is not a pneumothorax. In fact, it is a large emphysematous bulla. See, we can see very well clearly see the lung margin is there. So if this would have been pneumothorax, it should not have spared this lung also. It should have completely displaced this lung also to cause complete collapse of this right-sided lung. So this CT scan has some very interesting findings like a large emphysematous bulla, which is completely pushing the mediastinum towards the opposite side. It has a cystic lesion, uh, bronchiectatic changes, along with uh, very less spared right-sided lung. So thanks for watching.